I was a youngie, so I was 15 when I was pregnant. I was 16 when I had her. So I feel like the doctors were very in tune with how I was doing, with how my body was changing. You know, they were very helpful. They offered me a lot of prenatal care at all the appointments. And when it was time to have her, I had a midwife, and she was awesome. You know, she was the same midwife I had during my appointments. So when it was time to have the baby, she was just there the whole time, like holding my hand. We had gotten to this like jacuzzi to like soothe the pain. So that was nice. And it was like stars all around the room. So it was beautiful. It was nice to have all that support, you know, and to have so many things in place to make the pain less because I went natural with her. Even though I was a teenager, I went natural. And I mean, I feel like it was a good experience. I feel like the doctors were helpful with how I was feeling mentally and physically. You know, when I was pregnant and after pregnancy, they had made sure I had prenatal care afterwards and making sure that my baby was meeting milestones that she needed to. Um, and I also feel like they were helpful because the midwife having that extra support besides the doctor, you know, I feel like that made a difference. My third pregnancy, um, no man in the room. Uh, I feel like there was support there, but when I came to them about my complaints about my body changing, like my feet were starting to swell up and I was starting to feel dizzy in the morning. And I would complain to them at least 3 visits. I've complained to them like consecutive visits. I complained about my feet swelling and my dizziness, and they were just like, "It's fine, you know, it's part of pregnancy, it's normal," and things like that. And we'll just double check at your next ultrasound. So I'll go to my ultrasound for my 24 week. So I just found out it was a girl the last 4 weeks before, and then I went to my ultrasound of my 24 weeks. And we're doing our normal exam and looking at baby, and they noticed something, and the lady left out the room. And I'm panicking at this point because she left out the room in the middle of our ultrasound. And then she comes back and she says that baby heartbeat is no longer there. And I was just like devastated, really devastated. I just started screaming and called my mom uh, for support. And the doctors, they were just like, "We're so sorry. We don't know how this happened. We don't know what could have happened. We're going to do the best we can to figure out what caused this." And they're like, "But you got to have the baby." And I was like, "Have the baby?" And they're like, "You have to deliver the baby because the baby is a whole baby." And so they told me to go home and to like prepare a bag to give birth to the stillborn. So I went prepared and I came back to have the stillborn at the hospital the same day. Um, and they were very supportive. They made sure I did the jacuzzi thing and all of that. All of that seemed different this time because, you know, I was giving birth to a baby that was not even going to cry or anything. So I delivered baby, um, and they kept the baby in the room with me for a whole day. And that was hard for me, you know. Um, and the second day it was time to discharge. They sent me home with um, a basket with just a whole bunch of things reminding me of her. They made a little clay of her toes and things like that. And they called me a week after that and saying the cause of the baby death was hypertension or high blood pressure. They said that my blood pressure was high. And I was so hurt because I was like, I constantly complain to you guys about feet swelling and dizziness. And those are all signs of high blood pressure. And they ignored all of that. And I feel like that could have prevented what happened to my baby if they had listened to me. They shouldn't ignore patients' concerns that they have with their body. If they feel that there's some changes going that does not feel normal, they should just take extra precautions just to be safe, to prevent this from happening to any other moms or babies.